So week 4, I do it all in the Kahoots versus giving you the PowerPoint, but you've got a great PowerPoint to go back and look at. Chapter 39 is huge. There's so many variations, nursing care, which means the difference between adults versus children. So read the chapter, and it's a long chapter, okay? I can only put so much into a PowerPoint or into the Kahoots. So it's one of those chapters, I'm sorry, you got to go back and look at, all right, in the book. So tonight, just what we're doing in order to do the, today and get it in the amount of time, I decided to do a Kahoots. And I went and I made sure that those concepts are there that you need. My Kahoots always are going to tell you, those things. I got to think about that. Do I understand that? If I can take that, can I use it in a different way? So let's start with our Kahoots and go from there. And here we go. Remember, this week, all you have is a discussion question. Okay, there's nothing else due, so it's a pretty light week. What I suggest is week 8 does have a pediatric assessment. It's 3 parts. I would suggest that you at least choose your topic and maybe just write the 250-word paper. It'll get you ahead because between community, med-surg 2, and pediatrics, it gets rough about week 9. Okay, so it's just one of those things I tell you, I think it would behoove you to do it.
Professor, it's already rough.
Well, I know that. It's going to get rougher. It is. It's going to get rougher. You have a project in community, a project in peds, and then med-surg 2 is not easy, period. Who else is joining me?
I'm coming. It's slow and slow. I'm sorry.
It's okay. Go ahead. The final exam grades will be coming out around midday on Saturday. The last pediatric exam is me. It's Friday night at 8 o'clock. I have to get together with the other pediatric professors to see if the questions were okay, to see if we're going to change any answers or if we're going to just accept it the way it is. So I will get that out early Saturday afternoon, but everybody passed. So just take a deep breath and just know that. And I know for some of you that's good enough. I've had some crazy, I just wanted A students reaching out, but you all did extremely well. Week 4. Early detection of a hearing impairment is critical. Which one is of primary importance? And when you look at chapter 37, where sensory, problems, hearing and speech and, cognitive delays, Downs and Fragile X and hearing, I mean, why sometimes don't you hear? What does it affect? And it's all about the speech. If you can't hear, how can you pronunciate words, right? If you can hear correctly, that's good. And finding that out with children and identifying it quickly and giving them either hearing aids or checking their hearing or whatever quickly can really help them. A multi-select. A toddler goes to the emergency room complaining of a fever, headache, a rash that is milky fluid. What's your priority seeing these sort of symptoms? What do you think that could be? I think you see by the answers, it's something about Why a mask? Why MD? Why isolated? It's possibly chickenpox. And it's also another thing that can be described as a rash that does have that milky, juicy sort of vesicles, but it's also at different stages of healing. It's one thing I was taught. And we know chickenpox is extremely contagious. So mask on yourself and the child, and then isolate them. Get them to a room that has what we call a reverse airflow, so that that air from that room doesn't go everywhere. Because even if you're vaccinated against chickenpox, you can still get it. Another
Is
multi.
reverse, I'm sorry, is reverse airflow?
Child playing outside runs into a piece of wood, gets a laceration on his forearm, and he needs stitches. What are you going to do for this child? I'm going to go into that in a second. Don't worry. So a kid has a laceration and they're bleeding and they're already thinking that they're going to die because their blood's coming out, right? So number one, we got to get them prepared to be able to do that suturing, right? So numb it. Number one, let's numb it. Now, Child Life is this great group of people. I know when they first came into Nicholas Children's, where I was working in the ER, I was like, who are these people in my room talking to my kids? But I got such a great love for them. They let them touch and feel, and they talk, and they learn how to just, all the distractions and help kids get through this sort of thing. Now, you never want to hold a kid down. You don't want to restrain them like that. And do not let them see those little needles for suturing. They're going like, they don't like needles, right? So get them distracted, get them informed, and that numbing cream, and let them know it's going to feel touch, no pain. Regarding reverse airflow, what that is the air circulated outside. It doesn't continue inside. Usually every unit in a hospital has at least one reverse airflow. You would use that in TB. You would use that with pertussis. All those airborne sort of very communicable diseases are put in those rooms to protect the rest of the hospital.
So that's also negative. Is that the same as negative pressure?
Negative pressure airflow.
Okay.
Absolutely. Yes, ma'am. A parent recognizes that their toddler has a speech delay compared to their older siblings. Nursing priority. What do we need to do? Parents know their children, and we need to listen to them. And sometimes as pediatric nurses, we're like, can these parents just like chill out? But you know something? They really give us some key information that can help us take care of our kids. Speech delay, number one thing, get them for a hearing evaluation, number one. After that, when we know they hear, then you put in the speech therapy, okay? So number one, make sure they hear, then put them in therapy for speech. A multi-select. What are early indicator of impaired cognition? A kid's just not doing things the way they should. Gross motor skills, fine motor skills, they're not up to where they should, right? So knowing the things we know is, we know that if they're not talking, at least mama, dada, nana, pop, something by year old, something's wrong. They should at least be saying a couple words, one word phrases at this point. They can't grasp anything at 7 months, they're behind. And we know if they can't talk, they can't express themselves, they're very unhappy. So you're going to have these children who have these behavior difficulties, right? They're acting out because they want to talk and they can't, and they're frustrated, okay? A child is being treated for a fever. The reason for treating the child's fever is what? Now we give Tylenol for the first 6 months of life. And then after the first 6 months of life, we can add ibuprofen. Why don't we give that ibuprofen earlier? There's something to do with platelet and coagulopathies and ibuprofen, so we can't. It's not good for that infant, but at 6 months we can. The only reason why we treat a fever is because of the discomfort. How do you feel with a fever? You feel miserable, right? Once that fever's down, these children go from sleeping, not moving, not wanting to eat or drink. They're up and they're running, they're eating and they're drinking, which is what you want them to do, right? So it's only for relief of discomfort. When you talk about life-threatening complications, you think about that is a febrile seizure. A febrile seizure is when you go from no fever to a 101 in 20 minutes. So that rate of rise, how quickly it got there, creates seizures. Okay. And usually maybe 1 or 2 times it happens. If it happens more frequently, then of course it's epilepsy. But if it's 1 or 2 times, very sporadic, that is what we call febrile seizures, and they'll grow out of it by the age of 6. Multi-select. A child's complaining of something is in their eye, causing tearing and pain. What are you going to do? So when you hear tearing and pain, it could be something in there, could be, something that has scratched the cornea. So looking at there, do a visual. If you see something floating and moving around, we know it's not penetrating. We can take a little piece of tissue and get it out. Now, if we see something sticking in there, we are going to do nothing. Put these Fox shields, they're like a little bit harder, and you're going to put them on both eyes, send them to a pediatric ophthalmologist or a pediatric ER. The other thing, we're going to check for reaction to light. That really shows how much of an emergency is. So if it's not reacting, this eye is in big trouble. It needs help like as quick as we possibly can. Separation anxiety in a child hospitalized, which behavior indicates the stage of despair. Now, separation anxiety has 3 different stages. Okay, they go through that, screaming and yelling and crying and going crazy, and then it gets to the point where there's stage of despair, and then they get like this acceptance. At the stage of despair, what are they going to look like? Well, they're realizing mom and dad have to go. I mean, people have to work. They have other siblings they have to take care of. They have other responsibilities. Sometimes they have to leave a child alone in a hospital. I mean, as nurses, you try to do the best for them, but the kid just wants mom and dad. So what they do is they regress. They'll start sucking their thumb, or they want a bottle or a pacifier, or if they're potty trained, they're going to be incontinent. And this is something to be expected with separation anxiety. A child with a history of abuse, which therapy explores emotional problems. We've talked about play, and play is such an important thing in children. And we can learn a lot about a child through different therapies, right? And we just call it play therapy, okay? Whether it's dramatic play, it doesn't matter. It's still part of, let me see how you play with dolls. Let me see what you do with them, and you say, so tell me about, what hurt you or gave you that bruise or that bump. And they can show you through, dolls or, stuffed animals, and it's non-threatening to them. A multi-select. When can children react to stress and anxiety of hospitalization? Do children react before, during, after, or not at all? When? Got to go in the hospital for a week. They need a bunch of testing, or they need surgery. Before, during, and after, all of it. Children do stress out and they do have anxiety. That's why we try to teach them what's going to happen. and bring them in before, let's say they need surgery or they need it, an x-ray or some special procedure. And then during it, realizing they need a way to express how they're feeling. And when they get home, they're usually out of it for a day or two, or maybe an hour or two, and then they acclimate back to home. So this is to be expected. A multi-select. An adolescent goes to the ER for treatment without parents. How do you get consent for treatment? You can't treat a kid without parental consent, right? Or can we? It's grandma, it's abuelita. She's got the kid. It's okay, right? Well, if the child is 18 years old and cognitively aware and competent, they sign for themselves. In fact, you cannot give information to those parents without that child's consent, that 18-year-old's consent. If it's an emergency, they come in trauma off an airlift, or grandma comes running in, there's something's going on, 2 physician signatures will get that child through that emergency treatment. Then they get the consent from the parents. Also, grandma brings them in, the parents aren't there, they're on vacation, they didn't write a little note that say just in case, they can call them and 2 people have to witness it, okay? But any child at 18 with proof of age, are they competent? That's the key word. We don't know if they're competent or not. If they're competent, yes, they can, but not any 18-year-old. There's 18-year-old cerebral palsy, nonverbal children out there, right? A child is extremely fearful of hospitalization. What type of play explores these fears? And is actually what we call dramatic. So it's a drama, right? It's drama. I want to know what you're afraid of. We can have pieces of equipment there and they can touch and feel and tell me what they're afraid of, okay? Diversional is when you do something to have them think about something else, not what's happening, giving them some distraction, okay? When checking an IV in an infant, you notice the tissue around the IV is swollen. What do you do first? 10 mLs into an adult's arm of IV fluids is nothing. Do that on a child who weighs 600 grams. It is a lot for them. Number 1, stop the infusion. Then you can take it out depending on what's been in there, if we don't have to insert anything. And we also nice warm pack on it and elevate it afterwards and restart it if it's needed. In helping a child to adapt to a hospitalization experience, the best approach is what? It's really hard to bring children in the hospital. Toddlers, I think, are the hardest. Preschoolers deal with it a little bit better, but how do you help make it better for them? Keep them on the same routine as home. What foods do they eat? Their naps the same time, their bath time at the same time. Maybe they get up and they change into different clothes if they can. Why not? Keep them on that same routine and they'll be a happier child. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? And then I ask you, if you can't see anything at this distance, what would you do? I mean, it's 20 feet. If you can't see it 20 feet and they have to get closer, this is something you would tell the physician about so they can really look at that child. Multi-select. Nursing care of discharging a child to home. What information, what do you need to do or give these parents and this child to get them home, for them to be safe and really take care of themselves at home without going backwards, right? We want them to continually getting better. You want to have a, not provide written instructions, not only to the parents, to the child. The child needs to know what's going on because they are going to do that better. What's going to happen? What should it look like? When are they going to feel better, et cetera, the expected outcomes. Emergency phone numbers. Who do you call if they start bleeding, or if they start coughing, if they start this or that? You have it. And also make sure, does the parents understand what you've told them? Have them talk back to you what it says. What is a 3-year-old biggest stressor of being hospitalized? 3-year-old, that's your beginning of preschool. They want mommy and daddy. They're a fear of being separated from their parents. You know, they can deal with a lot of things as long as mommy and daddy are there to hug them. A multi-select. What is the best way to alleviate the stress and anxiety of a hospitalized child? You know, we think kids that go in the hospital and we don't worry about stress and anxiety. And I've done many researches on these young children, and they do, and they get very anxious. Just keep them on the same routine. Absolutely, we've said that before. Keep the parent with them if at all possible, and always explain what's going on the level developmentally of those children with words that they understand. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention would be what? You know, I have this little, if you look at it, I have a little blue little cat's eye here. I was given this by a parent. Same sort of concept. And that concept is to protect them from evil spirits, right? There are things that certain cultures do. It's like a protection. You know, you have usually in the Cuban, it's the black and white. This came from a Colombian woman. I took care of her, it was a cardiac son way back in, I don't know, 2006. And I still have it here, and I'm still being protected by that woman and that family. How can a hearing impairment develop? It's like, are all kids born not hearing? What happens? How can it happen? You know, all of these answers are correct. They could be born with a malformed ear, you know, some sort of defect that's been present at birth, or children, chronic ear infections. If as nurses, we don't teach them how to take care of their ear infections and continue all the antibiotics till they're done and then go back for checkups, it could cause these children not to hear properly. So nursing is very important in preventing hearing loss. Which urine collection method on an infant is most accurate? Remember, infants are very open to infections. Their immune systems are very, very, low. They don't have them as strong as we do older children. So we want to get an accurate culture sensitivity the first time. And the only way to do that is a straight catheterization. Because think about it. You have an infant, smelly urine, you do a bag urine. Is that accurate, or is that just contaminants from, around the tissue of the skin of that infant? You don't know. A catheterized specimen, you are getting really good urine, you're getting a great sensitivity, and the first time these children are on the right antibiotic. not 2 or 3 times later. Because remember, they have no immune system that's really big and strong. So we want to treat it the first time. I'll multi-select. What is the purpose and function of the family? They have that safe environment. They also give that comfort, identity, and they also give the values, attitudes, and beliefs. And family is so important, especially on the younger children. And even as they get older, they need that support. They need that person to go home to, give me a hug when they have issues, even adolescents. The primary goal in caring for the child with cognitive impairment is to what? You know, years ago, cerebral palsy children, we used to have them in these homes, and we would used to make sure that they were fed and they were bathed and they got out of bed and exercised. But we really didn't think about their cognitive development, did we? And I know that for real, because I worked with these children since I was a teenager. Today, we will take a child, little Jonathan, he's at Patches. And this little boy and me, we bonded. He is a spastic cerebral palsy, nonverbal. He sees me and he arms go up and he gets so spastic because he knows I'm going to go there to hug him and give him a big kiss. That child goes to speech therapy and he has a pad and he can push what is an oval and he pushes it. What's color red? And he can push it. This is something that was unheard of 40 years ago. So today we give them goals and we teach them. And these children are so happy because they are learning and they can express their needs, even that nonverbal kid. And I miss Jonathan. Many infants require oxygen. What type is best tolerated and accurate? A lot of infants come out and they have a little bit of, transient tachypnea of the newborn and need a little bit of oxygen for the first little bit. And there's many different ways we can give it. And if you put a nasal cannula on, it's taped to the face, and this thing is blowing up in there and driving them crazy. So their finger is going up and they're getting it out of there. Yes, it is accurate. The oxy hood is this clear plastic hood. You can measure the oxygen, give an appropriate amount. This kid can suck his fingers, his thumb, a pacifier, look all over the place, and nothing is on his face. He's so much more happier with an oxy hood. What is best practice for school-age children with special needs? Special needs could mean that they have hearing issues, visual problems. Could be that, child who has a myelomeningocele, which means that they're paralyzed most of the way, the lower extremity. They're in wheelchairs. Does that mean that they're not alert enough? I'm telling you, I have met children. Manuel Louis, my myelomeningocele, this child went into mainstream school and he excelled. And I met him as a newborn. Children with special needs should be, and they are, integrated into regular classrooms, and they do very well. Multi-select. Collecting a heel stick blood specimen on an infant. We rarely take a needle and stick it into the anticube on an infant. Only for bleeding coagulopathies, we need to do that. But we can take that little heel and we can get a specimen. You only need 1.2 mLs for a complete workup. Now, you do the outer aspect, not in the middle, because there's a calcaneus, a bone there. And we don't want to go too deep, so we want to make sure that Lancet doesn't do that. And how do we do it? Is we put a warmer on there. What does it do? It dilates the blood vessels, so it'll bleed easier. And if you hold that foot below the heart and squeeze it very easily, that child is not going to be bothered by it, and they're going to bleed really well. Referrals for cognitive impairment should occur when? You start seeing these, delays, right? That's why we do all this developmental stuff and we look at it. If they're not there, what do? As soon as we possibly can, we're going to put in for some sort of intervention, whether it's speech, physical, or occupational therapy, or all three. A client with mild intellectual disability. Remember, children born with intellectual disabilities become adults with intellectual disabilities, right? And a lot of them are mild. You have Downs 21. They're just very mild. They just need somebody to watch over them, right? But they can live independently, and they can live with just somebody making sure they're not being abused. I had a student like 2 semesters ago tell me she had a 54-year-old uncle who had Down syndrome, but he was very alert, had a job, and he lived on his own with 2 other people in an apartment, and he did very, very well. But remember, we got to make sure that nobody abuses these people, because that's what they do. They abuse these type of people. Down's children have frequent upper respiratory infections. Why do you think? This little nose is flat, underdeveloped, and mucus sits in there, and they can't get it out, and it drips, and it causes upper respiratory infections. Has nothing to do with the tongue, the mouth, the neck, none of that stuff. It's only the nose why it causes it. A multi-select. What would be included in the care plan of a patient with moderative cognitive development? I mean, any child who's not up to where they should be. And, they do need something to help them, to stimulate them to be able to learn, because these children are so resilient. And that's what I love about working pediatrics. They're so smart and they catch up so quick. So put them on a daily structure, expose them to sights, sounds, feelings, sensations. Toys are good if they're age appropriate and safe. And then those toys that teach them something. And if they're on that, these children go further than you could imagine. I met a little boy, he was autistic and he was Downs. That child should not be able to listen to anything. He would go in, and this is at Patches at this PPAC, where I used to do clinicals, and he would come in, take his backpack, put it away, and sit down and wait for his vital signs. And then he'd go off and play. That is unheard of when you talk about a Downs autistic child. Early intervention. A multi-select. Why do children with Down syndrome have frequent respiratory infections? I'm asking another different group. Again, it's that nose. They breathe in their mouth, so they're not getting rid of all that mucus because they have that stuffy nose. The tongue has nothing to do with it. I mean, those of you who are from Cutler Bay who have gone to this PPAC, think about those Down children. Usually Down's children sit there with their tongue hanging out. You don't see it there. Think about it. If you haven't gone to clinicals yet, I want you to think about that when you go there. It is.
Went to Patches too.
I know you did. Was their tongues hanging out? No, they do not. It's because of speech therapy taught them how to manage their tongues. They're in an amazing place. Multi-select. Autistic children demonstrate which behaviors? You know, autistic children are usually not diagnosed till ages 2 or 3, and they're mostly boys. That's the big thing with autism. They do not verbalize, they don't speak well, so language delays. They don't like eye contact, they don't like to be touched, they don't like loud noises, they don't like crowds of people, and they usually sit there by themselves in the corner playing, and usually you try to call them, they don't answer. Totally what an autistic child does. Repetitive behaviors too. Multi-select. Children with autism have better outcomes if what? Now, I always say they always do better with early intervention, but what is early intervention? Early intervention, what happens there? They're on that structured routine. They know what to expect and what's coming, right? They also tell them a way to communicate instead of screaming and yelling and these behavioral difficulties. And also, if they're doing behaviors that are unacceptable, then they will correct them. And that really helps them to not be all of these big outbursts. And therapy is also with parents and siblings, not only licensed therapists. A multi-select. Fragile X, second most common behind Down syndrome of cognitive delays in children. And they are similar in so many ways. The only thing different with Fragile X, they become extremely aggressive and require medication. Down syndrome, no. There is that intellectual disability, learning disability, physical, big ears, big jaw. There's different looks to them. But the differences between Downs and Fragile X is that they do get a little bit violent, and they do need medications to keep them calmer. Downs, no. But number 1, Downs, number 2, Fragile X. Causes of autism. Boy, I wish we knew the answer to this, right? We don't know. Genetics, abnormalities, unknown, we don't know. We just know that it will take a diagnosis between ages 2 to 3, and we know boys are more than girls. Ways children with hearing impairments communicate with each other. Sign language, finger spelling, lip reading, absolutely everything. Children that don't even speak the same language, they can communicate. So can these. What is amblyopia? Something to do with the eye. What do you think? Again, this is something this chapter 37 talks about visual problems and hearing problems and speech problems. Amblyopia is a visual problem. And it has to do the eye, just the muscle. It might go outwards or inwards. It's not where it should be. So how do we fix this lazy eye? Well, we want to make it work, strengthen the muscles, cover the good eye, make that bad eye work, and it will strengthen the muscle. Amblyopia. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? You know this answer. And again, let them play with the equipment. Absolutely. Preschoolers like that, then they're actually going to help you. Push the button. They do. What child may be more stressed when hospitalized? All sorts of kids have to be hospitalized. Believe it or not, is that kid who's been there a lot. This could be your sickle cell kids. And why are they more stressed? They could have had a bad experience. right? Or maybe they needed an IV stick and nobody can get it in. They kept hurting him. They had to hold him down and they made him cry. They made him scream. These are things children remember and that causes stress. So that child was in there a lot, so you're most stressed. A toddler has a hard time fixating on a single point. The child's eyes cross and they keep trying to focus. They're going back and forth. And it's called strabismus. Again, we need to strengthen the eyes on this child so that they're going to be working together. I'm multi-select. Safety in administering medications in children include what? So when you're administering medications to children, you always need to do that proper child dose, milligrams, micrograms per kilogram per dose. That means you can't just give 2 Tylenol like you do adults. And the only other way is to check their name band. If you ask them their name, they may not give you the proper name. They might have nicknames at home. And you never, ever give medications by the room number. Okay, so always check name bands. And there's a lot of different monthly type of things that they do in every unit, even the emergency room. They go around making sure that you have name bands on your children so that we could prevent errors. What can help the parents to make a baby swallow their medicine? The baby, you put it in their mouth and you have to hold their nose and you have to pinch their cheeks and they're spitting it out. How can you make them take it? If you take and put it in their mouth and you tell the parent, I mean, I used to do it myself, but with COVID and all that now we can't. You take a deep breath and go real quick. And what happens? That child goes and they swallow it. And it really, I'm telling you, it really, really works. Putting it in food or formula, did they take all the food? Did they take all the formula? Did they take all the medicine? Unless it's a tiny, itsy bitsy little amount, okay? But taking it and blowing a big puff works well. Not a little, I'm talking quick. Treatment for amblyopia involves, I told you, what is it? Cover the good eye, leave that lazy eye, and let that muscle work. Yes, sirree. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important? You have a teenage Down's child. What do they need to know? What do you need to do for them so they're not going to be abused, right? Because they will be. There's a lot of not nice people around. A well-defined concrete code of sexual conduct. They need to know good touch, bad touch, and by whom, so that if something else happens, they know what to do and who to talk to. I'm multi-select. A child is asking mom about his sibling in the hospital. How can you alleviate his stress and fear? It's not just a kid in the hospital.
Stephanie gone?
I think she's having issues with her internet again.
Yeah,
But it is 10:02.
exactly.
So I think we should call it a day. I don't know, right?
I feel so bad. I wanted to stay here, but
Good night,
All
guys.
right. Well, everybody have a grandiose night and sleep well.
good night.
Bye.
Bye-bye, good night.
Ay, ito me está saliendo.
No me deja salir.
The Kahoot is over.
Ahorita-
No me
ahorita
deja.
tampoco-
Guys,
A mí no me deja salir.
I was trying to leave, but it didn't let me.
Me neither.
I guess we're. Solo nos vamos a quedar aquí solitas esperando. Everybody
A
left
mí-
already?
I'm gonna wait a little bit.
Oh, no. We're not the only ones. Okay.
No me deja salir.
No, I already tried as well, and it didn't let me. Are you able to get out, Crystal, or you didn't try?
I
I
tried.
tried. No. Hi,
No,
Sylvia.
Hey, girl, how
How
are
are
you?
you, Chica?
Hi, I'm good. I'm tired, but I'm good.
I'm tired. Literally ran home from work in my helicopter.
Oh
Got the
my
exam.
God.
And when I got here, my computer wouldn't work because it wouldn't allow the camera to work. I don't know why. Had to go and get another one.
The struggle is real. The struggle is real.
It is so real, let me tell you.
How's Jackson?
Oh, Jackson, I literally have to leave these people and run away and tell them, look, I have to go. I have to go.
Oh
I made it home with 10 minutes before the exam and boom, I'm here.
But we passed, and that's,
Yeah. Something else.
Oh my gosh, she's not even on the thing.
Okay. Try again. Have a good night, girls.
You too. Good night. Let me
Yeah,
see
good
if I
night,
can-
everybody. I'm leaving.
Mhm.
Bye.
Mm-hmm.
Look,
Ow.